Let's jump right into this special Nurses Week explainer. Today, we're doing something a little different, something genuinely heartwarming. We're looking at a beautiful tribute to the highly skilled professionals who are, quite literally, changing the landscape of healthcare. How? By bringing hospital-level care directly into people's living rooms. We're zeroing in on the incredible work being done by Focus Family Care. And as we go through this, I really want you to notice how delivering complex medical care completely transforms when it moves from a clinical, sterile ward right into a family's home. We're starting right at the front door with a warm welcome, bringing hospital-level care into your home. I absolutely love this concept because it perfectly captures that profound, emotional moment when a wound care specialist, or maybe a pediatric expert, arrives exactly when a family is feeling their most vulnerable. It shifts the dynamic entirely, right? You aren't navigating a confusing hospital corridor, you're actually welcoming a healthcare partner into your sanctuary.
Which brings us to Section 1, Bringing Hospital Care Home.
This explainer is all about honoring the deeply dedicated Focus Family Care nurses who serve families across Palm Beach County and South Florida every single day. These folks are the quiet heroes in our neighborhoods. They're navigating the traffic, hauling heavy medical equipment, and bringing a profound level of expertise right to the doorsteps of those who need it most. It's a massive logistical and emotional undertaking, and honestly, they do it flawlessly. Now think about the number 15. In a typical hospital setting, a nurse might be managing up to 15 patients per shift on a busy floor. They're sprinting from room to room, dealing with a symphony of alarms, endless charts, and constant pages. But skilled nursing at home? It flips this completely. The nurses we're celebrating today are delivering focused one-on-one care inside your home. No competing alarms, no crowded, noisy hallways, just the nurse, the patient, and the family. Let's move to Section 2, Delivering Exceptional Skilled Nursing. The crucial point here is understanding exactly what this hospital-level care at home actually looks like. Let me tell you, it is so much more than just a quick wellness check. These exceptional nurses handle incredibly complex, vital medical needs. We're talking advanced wound care, administering IV therapy, performing life-sustaining trach care, specializing in delicate pediatric nursing, closely monitoring post-surgical recovery, and handling really complex medication management. These are rigorous, high-level clinical skills executed right at the kitchen table. And the real, tangible value of that expertise? It's in crisis prevention. They don't just provide medical care, they actively prevent crises before they happen. Expert wound care stops infections from escalating into something devastating, like an amputation. IV therapy keeps vulnerable patients out of the hospital entirely. Meticulous trach care literally keeps children breathing safely through the night. And proper medication management? That's an absolute lifesaver for patients juggling 5 to 7 different conditions at once. It's proactive, deeply attentive healthcare at its best. That takes us to Section 3, the home health difference. You see, home health nursing is fundamentally different. In a hospital, the environment naturally forces a focus on managing a full floor and keeping up with endless charts. But home health nursing focuses entirely on you. These professionals build real, lasting relationships. They learn your dog's name, they know exactly how you like your pillows arranged, and they understand your family dynamics. They advocate for the patient based on a real-world relationship, not just vital signs on a screen. They know what normal looks like for your loved one. This right here is the absolute secret weapon of home healthcare. Because they spend dedicated one-on-one time in the home, they know your loved one's baseline. That means they spot the tiniest early warning signs, a slight change in breathing, a subtle shift in skin tone, a difference in mood, and they catch those complications before they ever have the chance to become full-blown emergencies. Which brings us to Section 4, Real Impact, Real Peace. The impact we're talking about here is absolutely undeniable, and it's highly measurable. Because of this dedicated care, severe wounds heal properly. The rate of stressful hospital readmissions drops significantly. Post-surgical recoveries go smoothly without the patient ever having to leave their bed. And perhaps most beautifully, medically complex pediatric patients get the profound gift of growing up at home surrounded by their family instead of living in a clinical facility. Ultimately, for families who are carrying the heavy burden of caring for aging parents, managing a child's complex illness, or supporting post-surgical loved ones, the greatest outcome isn't just medical. It's simply this: peace of mind. It's what scared, exhausted, and overwhelmed families finally find when skilled nursing is delivered with genuine, compassionate care right inside their own home. It allows family members to stop being full-time medical managers and just go back to being a daughter, a husband, or a parent. Let's look at Section 5. Thank you, nurses.
During this Nurses Week, we want to extend a truly heartfelt thank you to every single Focus Family Care nurse. We appreciate the dark, early mornings and the long, exhausting shifts. We see you taking on the toughest, most complex cases that other agencies simply wouldn't touch. Thank you for sitting quietly with families through the absolute hardest, scariest moments of their lives. And thank you for knowing your pediatric patients' names by heart and treating them like your own.
Their entire ethos is built on one powerful idea, where your family is our family, and we put your family first. Now, in the world of healthcare, it's incredibly rare to find a team that truly embodies this, but Focus Family Care nurses actually do. They step into a home and seamlessly weave their clinical expertise into the very fabric of that family's daily life.
It's not an accident that families feel so deeply supported. It isn't just good luck. You make hospital-level care feel like family care. That's not an accident, that's you. It takes a very special type of person to balance that intense clinical knowledge with pure human warmth.
And finally, Section 6, extending a helping hand.
If you're listening to this and realizing, hey, we really need skilled nursing at home, whether that's senior home care support, complex pediatric care, or just dedicated family caregiver support, Focus Family Care is ready to help. You can reach out for a free consultation by visiting them online at focusfamilycare.com or just by calling them directly at 561-693-1311. You really do not have to carry the medical burden alone. As we wrap up this Nurses Week Tribute Explainer, I want to leave you with a direct question. If you have an exceptional nurse in your life this week, have you told them thank you? These quiet heroes have absolutely earned our deepest gratitude for the life-saving, life-affirming work they do every single day. So whether it's a Focus Family Care nurse or another healthcare hero in your life, who will you thank today?